My name is Thomas Modine. I'm professor of cardiac surgery and interventional structural heart therapies in Bordeaux University Hospital in France. Tricuspid surgery is at a very high risk because patients are usually referred late, and if they are not referred late, they are referred because some other disease. So if we speak strictly about the tricuspid regurg as an independent disease, we as surgeons try to avoid it. So there are very little options. I mean, we can do minimally invasive surgery, we do it. You can do a beating heart surgery, we do it. But still, the outcomes are not as good as we would love them to be and as they are with other valve treatments, surgical treatments. So the future and the needs today are more into developing and the development of transcatheter therapies, that's for sure, repair or replacement. So the TRINITY trial is exploring a new transcatheter tricuspid valve replacement in this landscape. This valve, this study will be using a valve called LuX Plus that comes from China. This is a Chinese innovation, which has some particularities. It uses transjugular access, percutaneous transjugular access, which is very new. And it has some particular features which renders this valve very adapted to the tricuspid regurg itself. The design still today, this is a pivotal trial. They're designed for Europe and European patients. And it's a single arm. We treat a tricuspid regurg patients who are severe and above. And almost it's all comers actually. There are very few exclusion criterias which is a good chance for our patients who are referred to us at high risk. But also, I mean, can use for other risks of patients. But TRINITY is focusing on high risk patients. So we found that this therapy covers a real need in the market of tricuspid regurgitation today, which is large anatomies. More than 70% of the patients needed a large size valve, which is not covered by any other device today. 55, 60, 65, or even 70, a large range of anatomy. Less conduction abnormalities, which translates in less pacemaker rate implant. No bleeding or almost no bleeding complications that we can observe also with other therapies. Very short hospitalization, very impactful in terms of quality of life recovery even after 1 month, as reflected by KCCQ, but also NYHA, and 6 minutes walk-in test. No thrombogenicity that we have been observing today, and a valve that you can implant with the same outcomes even if you have a pacemaker leads. Yeah, it is very surprising because this is not the first comer in this therapy. So they arrived very lately in Europe because they, as I said, they were in China. And then I must admit that when I looked at this device and I immediately said, wow, this has a potential. When I started talking about it with some other colleagues, there were some limitations. I would say they are more interventionist cultural limitations. The jugular access, for example. We are not used to work from the jugular. I mean, me as a surgeon, I'm used to do carotid access for TAVR. We developed it, so it was obvious for me. But for the majority of colleagues, they work from the groin, femoral access, easy, safe. The environment of the cath labs are designed for this, but not with this valve. So this one was one of the major limitations. And to be honest with you, there was also a doubt about the efficacy of this valve because it's coming from China. We don't know much about that, but which is true. So we had to overcome all this. And actually the adoption was super quick, super fast, and more importantly, the therapy was super efficient and safe for the patient, and that's what we are looking for. Don't ignore tricuspid regurg. It's a killer disease. And if it's not a killer disease, it has a major impact on the quality of life of patients. They don't suffer from pain in the chest, no pulmonary edema, but they don't feel well. They tell you they are tired, they don't go out. It really impacts their quality of life beyond what we expect. So tricuspid regurg should be explored, followed, treated. If medical treatment is not enough, refer the patient to the cardiologist who's a specialist in tricuspid regurgitation treatment. Transcatheter replacement, unlike other valve disease, is a chance for the patient, and we have been able to show this because it eliminates tricuspid regurg. It doesn't only reduce it, and with this TRINITY trial using LuX-Valve Plus, we have been able to show the efficacy, the safety of eliminating tricuspid regurg with a device that has a very, very low rate of any complications we observed in the past. We have to follow the patients for at least 5 years. So the 1-year follow-up data is gonna be presented hopefully for at the end of this year, and if not early next year. This is one. CE mark application for this device, which I think it's a very good thing for our patients in Europe. A pivotal FDA randomized controlled trials on which the company is working on today, and in which there will be other European centers also who will be involved. So it's an international approach for a global disease, and that we will be using this promising device.